Maternal and child deaths, according to the experts, has indeed become a public health emergency, with Nigeria rated by the World Health Organization (WHO) as the second highest contributor globally. At the national level too, about 40 to 60,000 women and several children under age 5 die annually from preventable causes. With a view to putting an end to this, the National Primary Health Care Development Agency declared a state of emergency of public health a few days ago.
Do they really have a plan for the emergencies they're declaring? If yes, what type of plan? Or maybe you just wake up in the morning because somebody's saying something, I hear something from somewhere, and you're in position of authority, say, okay, let's follow suit. It doesn't work that way. For you to declare an emergency, you must have the personnel on ground, have the resources on ground, and know much about what you're declaring.
There's been a statewide renovation of health facilities to improve the quality of services being provided. But a lot of PHCs are still not up to standard. A lot of PHCs still don't have the basic requirements to provide services the way they should be provided. Right now, the government is beginning to wake up to its responsibility, and it is indeed right for the government to have declared a public health emergency when it comes to maternal and child health. But what we want to see going forward is not a political statement, just to quieten down the voice of the advocates. What we want to see is an actual action to that pronouncement.
The experts advised government to put the issue of budget increment, health workers' welfare and training into consideration.
There's going to be a national coordinating office or center in the National Primary Healthcare Board. I think we have to go beyond that. What is the budget this year for health? Those are the questions we want to see. We're talking of the 15% Abuja declaration since 2001 for healthcare. How much is federal government actually putting in? Skilled, qualified personnel, and they have to be paid. And they have to be paid adequately. We cannot think of doing anything without investing in our health sector, and especially in areas like family planning. When we're looking at the exponential growth of our population in Nigeria, from within 100 years, 1919 we were about 17.5 million. Here we're talking 198. That's over 10 times in 100 years. If we continue at that rate, in another 100 years, we're going to be 2 billion. I mean, that's mind-boggling.
A similar declaration is also expected across the states in the next few days to achieve the vision of reducing maternal and child death by half in the next 2 years.